and she's been fine ever since.
It seems that any local who is truly sick that runs into Howard has a life-changing experience.
Back in 1978, I thought in very good health, living a very normal life, and my husband discovered a lump in my breast. So we went to a gynecologist, and he sent us to a surgeon. The surgeon did a biopsy. He said, "You have cancer. We will have surgery in 2 days." I got a pamphlet in the mail, I still think it's a miracle, which said that Charlotte Gerson was going to give this lecture for the National Health Federation on cancer. So I said I might as well go and listen, because that's another way. And I listened to her. Everything she said made sense.
I started to wonder how the critics would react to these testimonies.
After the therapy, we went back to Utah to a specialist on blood, and she said my blood was so clean and clear that she couldn't tell I'd ever had cancer, and she said I was the first patient that ever happened to. And I have two doctor friends that we're very close with, and every time they thought we were doing quackery, doing this, and they said every time he sees me, he says, or calls on the phone, he says, "Well, how are you feeling now, Don?" As if any day I'm going to fall down dead.
I started to wonder if this is just coincidence. The next lady had had breast cancer.
He did the biopsy, found out it was cancer, called me back in, told me. The doctor explained to me my choices. One was a lumpectomy and the other one was mastectomy. And because of the lumpectomy, just taking a large portion of my breast, I thought that maybe I should just have the mastectomy. And so when I told my husband, he told me that he had a client that his mother knew about nutrition.
Of course, she was talking about Howard and his mother, Charlotte.
The first phone call I got when I started taking the phone calls was my gynecologist, and I was telling him what I was doing, and he told me I was making a big mistake, and he even said he would recommend me to a doctor up in San Francisco or Stanford or someplace, and that he wanted me to go and talk to him. And I said no, that I wouldn't do this. This is what I wanted to do. And it just shocked me and scared me for like 1 second. But then I knew what I was doing was the right thing. The other doctor I went to was just my regular intern. One of them told me I was like committing suicide, and that was 11 years ago.
Prostate cancer had struck this lady's husband, Howard CPA.
Oh, almost 6 years ago, Howard, when I had that needle biopsy and sent the biopsy up to Stanford, and they sent it back and said, well, it looks like cancer to us. So I decided I know what I'm going to do. Gerson therapy for me.
Howard explained to me that even the daughter in this family, who had pleurisy, was healed with Gerson's treatment. All three in one family with different ailments, all cured. All with medical records to prove it. Coincidence? The colors of fruits and vegetables are derived from a variety of chemicals called antioxidants. Only plants produce antioxidants. Antioxidants subdue what's wrong in our bodies. A law of nature Dr. Gerson understood and used. Just outside San Francisco, I was scheduled to interview Dr. Dean Adele, a radio and television personality who reports on health and science issues.
I don't think the Gerson's therapy has ever cured a terminally ill patient. People get very confused by this. This is a world of science, a world of data. I always like to think of it as a courtroom, the courtroom of science and medicine. You don't send somebody to jail or convict somebody without hard evidence. And Gerson has been looked at many, many times. If you think of basically what's in Gerson therapy, you really wouldn't expect it to cure cancer. But people... Sometimes cancer cures itself. There is a rate of cancer that goes away by itself. Some people didn't really have cancer. It was a misdiagnosis. Sometimes people had chemotherapy many months before and then try, for instance, Gerson therapy. They get better and attribute it to the Gerson therapy or whatever they've done. So, no, I don't think there's any evidence that anybody's ever been cured by Gerson therapy.
The problem with the scientific proof is that the allopathic medical world has defined scientific proof so narrowly that the only thing which can be tested using their definition are drugs. In her final editorial as editor-in-chief of the New England Journal of Medicine, Marcia Angel, MD, asked the rhetorical question, is academic medicine for sale? And throughout the article, she answers emphatically yes. The pharmaceutical companies have totally corrupted the institutions, the researchers, and the publications to the point where medical research is literally an advertisement for drugs rather than actual research for the truth. Dr. Gerson published more than 50 publications detailing his therapy and many other subjects in the world's finest medical journals at the time, and all over the world, not just in Germany, but all over the world. There were hundreds of other articles by senior medical researchers and esteemed medical scientists confirming his work, also published in the finest medical journals of the time. So if the critics cannot find any publications by Gerson, they need to find a new research assistant for sure. He did publish several papers in the United States right up until he started to submit articles on the subject of cancer. At that point, he was totally and forever banned from publication in the United States.
Dr. Gerson was a German Jew who lost his 7 siblings in the Holocaust. According to his daughter Charlotte, he faced another Holocaust in the United States, witnessing the deaths of untold thousands after his successful treatment was rejected by the medical establishment. Gerson's treatment did not use or need drugs. Essentially, the vegetables and the juices in conjunction with coffee enemas did the trick. Coffee enemas have been scientifically proven to aid the liver in detoxification with the rest of the Gerson protocol. It would seem that our pollution-damaged bodies are in need of this now more than ever.
I'm a coffee drinker, and I drink it. I cannot imagine a cappuccino through your rectum.
We've lived in harmony with nature a long time, but in less than a century, all that has changed. Toxins in our environment are now off the charts, and cancer rates have blasted skyward as well. Fundamentally, does our health really boil down to breakfast, lunch, and dinner? Does the Gerson therapy provide the key to initiating a return to living sustainably on this planet? How can its acceptance be accomplished?
What would it take to convince people, and yourself, that the Gerson therapy has merit?
That's a simple question, Steve. What would it take to convince me that the Gerson therapy works? A simple double-blind study, follow-up, real data. And, of course, we'd all beat a path to Gerson's door and a Gerson clinic's door if it turned out to work. And why people don't do that, I don't know. This is how you convince science. This is how we move forward. This is how we got to where we are today.
I agreed with Dr. Dean Adele to move forward, and so I drove south to Los Angeles after hearing that Charlotte Gerson was giving a lecture at a health convention in Long Beach. When I entered the convention building, I got the feeling that I was about to meet many people who are dissatisfied with the effectiveness of orthodox medicine, that felt smothered, restricted, and force-fed medical propaganda that simply didn't work. Why else would they be here? Which gave rise to another observation. If orthodox treatments for cancer and chronic disease really worked, I would think nobody would want to come to hear Charlotte Gerson talk in the first place. Take this audience member, for example. There were many like him there.
3 years ago, I discovered I had lymphoma cancer. I had the best chemotherapy that there was, and I thought I was cured. 2 years later, the cancer returned at a higher stage. It was stage 4. I then commenced my second set of chemotherapy, but I realised that the prognosis was poor. During the chemotherapy, I did some research. In fact, I spent 3 months of researching, and I found that the Gerson's therapy was my best chance of escaping this cancer. And I then decided to meet Charlotte Gerson. I'm from Australia. I flew out just for the weekend to meet with Charlotte and hear her talk.